In the 1960s, local faith and community leaders were inspired to look closer at poverty in Northern Virginia. Many people struggled to feed and clothe their children. By bringing small programs run by volunteers into one central organization, these leaders saw an opportunity to mobilize a greater array of resources. Over the years, this effort led to wonderfully targeted programs and broad community engagement. At UCM, our programs have evolved from simply giving goods, food and clothing, to comprehensive support in helping families gain stability and move out of poverty. We have two goals for the near future that tie in with a long-term objective to break intergenerational poverty. These goals are to increase employment services and early learning and youth services. By providing support to both generations, adults and children can move forward together. In part, this requires expansion of community partnerships to ensure more seamless and effective services. And in part, more staffing is essential to keep families connected. These goals require board and staff commitment as well as increased sustainable resources. Embedded in a community with large pockets of poverty, we feed hundreds of families each week, thousands each year, who want to improve their lives but lack resources. In some cases, a small barrier becomes a major blockade. Families lose hope and stability. Fortunately, our caring staff and volunteers, many from the very community we serve, give us a unique resource to help lift people up. We combine this with systems that look holistically at individual lives and at broader neighborhood concerns. Working at both levels ensures isolated issues are fit into a comprehensive whole. Aspiration, collaboration, and excellence. First, aspiration. We strive to do more and to do better. Our staff and volunteers aspire to better serve clients, and our clients aspire to better lives. Second, collaboration. Each of us and each of our programs requires work with others to achieve success. Our clients, other agencies, and community members all contribute to our effectiveness. Third, excellence. We don't settle for just good enough. We set clear goals and outcomes, assess, plan, act, and then reassess. Each program has a logic model and measurable outcomes. Every 2 years, we reassess each program to ensure that our metrics are appropriate and truly measure success. Our board of directors, as well as supporters, receive regular reports on these measures. In line with our expansion of employment services, for instance, we're restructuring and adding long-term career metrics to our work center. Our metrics include preparing for kindergarten, improving grades for older students, obtaining a job, or paying rent on time. They're designed to show that people are moving forward, not just receiving a service. Our food bank isn't just about handouts. Food is an opportunity to increase understanding between members of diverse backgrounds and to educate families in need about other available services. Food donors come to understand the difficulties of finding affordable, healthy options. Donation recipients find a connection to further resources. We're so much more than food, but the demand for food reveals plainly what's happening out of sight in homes across the community. We'd like people to remember that food donation is a critical part of our work, but also understand that other UCM services move people on to success. Personally, I think the bright smiles of children graduating to kindergarten is one of our greatest successes. But accomplishments come in many forms. Our Journeys program helps families fleeing domestic violence to stabilize their lives and gain freedom from fear. Our community programs connect youth and adults to each other and to the larger world. For instance, a leadership class in a low-income neighborhood led to 3 parents joining their school's PTA board. They found their voices and raised them in support of their children. Small accomplishments each day add up to major successes in changing lives and communities for the better. Several challenges remain in our efforts to fully serve the community. First, lack of comprehensive public transport and a sprawling suburban community limits unity. Poorer families struggle to move physically between home, work, and school. Second, many active and potential donors are unaware of the full scope of our work. Our growth in services has not been matched by sufficient growth in financial support. With additional funds, we could expand our employment and education services. Most importantly, we could tie them together in a sustainable effort to fight the generational effects of poverty. For instance, early learning preschools prepare children for kindergarten and ensure that children from diverse backgrounds begin school on the same learning level. Often the parents of low-income households need additional support to help these children maintain progress during times of unemployment or illness. Providing holistic family support, including connecting parents to training and job opportunities, ensures families can stabilize and then move on to further success. To address the lack of community focus in a sprawling suburb, UCM could unite with other nonprofits to create a center. Connection Point is a vision shared by local nonprofit leaders. This center would bring together potential volunteers, new residents, and residents still in need of services. Building a nonprofit community space would bridge neighborhoods, poor and wealthy alike. The impact would be enormous in uniting services and people who want to make a difference in their own lives and in the broader community.